This is Christine Porter with the Times News. I'm here today with Dr. Shawn Mendonca, a urologist with Lehigh Valley Health Network. We're talking today about the option of surgery to treat an enlarged prostate.
And a lot of patients sort of kind of wait a little bit too late. Let's say you have an enlarged prostate and it doesn't bother you. Sometimes over time, if you give it 20, 30 years, eventually the bladder stops squeezing because it's been fighting against this enlarged prostate. So I would say seek treatment relatively early. It doesn't have to be when you start having symptoms, but maybe if you're having symptoms for 5 to 10 years and you're somewhat bothered by it, maybe it's time to seek a urologist because the surgical, let's say the medical treatments don't work. The surgical treatments are so minimally invasive. There are no incisions. All we do is we put a camera through your urethra and like I said, there are many ways of doing this, but the short version of it is we open up the prostatic channel so to enable a better flow when you urinate. And really, for some procedures to do this take 10-15 minutes. The others take an hour or so. So it's literally an outpatient surgery. Very good. It's not like you're having a big time operation where you have to recover for 4 to 6 weeks. Nowadays, it's minimal recovery. You can get back to work within a week or two. Some patients don't even listen to me. They're back at work the next day. I have men who are in their 60s that I do this, the sort of most gold standard surgery is called a transurethral resection of the prostate, where I scrape out part of the prostate. And these men who are in their 60s, like, oh my God, doc, I'm peeing like I did when I was in my 20s. I wish I hadn't waited this long to get. This is a quality of life issue. So if you're happy the way you are, we don't do anything. But know that there are many options. And if you want to improve your quality of life, they do exist.
Thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.